Are off schedule, whatever you cannot make on Sunday or something like that. It's 24 hours spread or watching and they
at the office, folks.
No, have that on.
Yes.
Small range, but
Yes.
because you know, sit at the table with all of us, I mean, Ryan, since we have a open concept. Kids do. No one else is doing it. Nobody else does it. Yes. You guys are ready to start.
Yeah. Hi there, everybody. My name is Ellen Mosier, so most of you know that, or the big pregnant lady. So thank you for coming out tonight, and we appreciate you supporting us and taking time out of your evening and sharing a meal and then listening to the big guy behind me. I wanted to take a minute to share with you my story, and everyone, not everyone, but most people know my story. Little girl, growing up, had a lot of headaches. Didn't realize what they were, just thought they were normal. That was my norm. Got older, went into college, so I'd like to be a very studious person, and so I was stressed and a lot going on, and I had way too many things on my plate. So I started noticing that my headaches were becoming more fierce and more at a time. So within a week time, I may have 5 or 6 migraines. So to me, I didn't know that difference between what a headache was or a migraine, but I knew that it was normal for myself. At the time, see, we met in high school, and we had been dating for a while, and I followed him to Hanover College. And so we're in school, and he gets to see me dealing with these lovely migraines. So he's like, you know, this isn't right, so we need to do something about it. So the only thing I knew to do is go to my general practitioner. So I went, and they said, well, it sounds like you're having migraines, and that's what we're probably going to diagnose this as, but we need you to see the neurologist. So I go to the neurologist, and they put me on 2 medications. One was a preventative, so I took that daily, and then the other one was I could get in one of 2 forms. I could get a pill form or a shot form. So the pill would, within the onset of a migraine, would work within an hour, and then the shot would work within 15 minutes. So they're like, what do you want to do? And I'm like, shots, not for me. I can swallow a pill. Because some people can't swallow the pill, but they just take a shot. And I'm like, no to needles. So I get this pill, but it doesn't work fast enough for me. So I do go with the shot version. And I did have side effects of it because my body just reacted to it differently. And I still went with it because it was, at the time, worth it. But what I noticed is I still trended to the migraines. So it didn't just quite cut it. So we kind of, did we struggle?
With the migrants?
With us.
Well,
Yeah?
a pain in the rear.
So that's what he says. So we didn't go out on dates as much or hang out as much because I was more or less in my room trying to study, and I couldn't study worth a hoot. So I'd be in bed with the blinds closed and everything. So that wasn't really fun for myself, but I also felt for him for, hey, go get me a chicken sandwich. Hey, go get me this. I don't feel good. So he got to hear a lot of that through probably about half of our college career and up to that point. Hi, I got you. So finally, long story short, he was wanting to explore his career options. He knew he was going to go into healthcare, but he didn't know what avenue. So he was thinking physical therapy, occupational therapy, being a personal trainer and coach, and a lot of those doors closed naturally. And it was weird because one day he got a email from Logan University, and he opened it up, and he was like, "You know anything about chiropractic?" And I was like, "No, my dad says don't go." And that's all I knew. And his mom's a nurse, so he ran it past his mom, naturally. She was like, "Oh, no, you need to go somewhere else. Like, just keep trying the closed doors." So we eventually looked into Logan. It's in St. Louis, Missouri. And through that process of looking, he went to an intern at a chiropractor that his family was aware of at their church. And so he shadowed him, and he said, "Ellen, you need to really go there because maybe they can help with your migraines." So my long story short is I went, and within, well, it was really less than a month, I was down to not having migraines at all. And it went by quickly. So, anywho, I didn't have migraines because of the chiropractic care. So that kind of solidified his career choice and what he was going to do. So, that is more or less my story. So tonight, we're going to share with you more about chiropractic. I'm not. I said that wrong. He is going to share more with you about chiropractic and the benefits and the exciting things that come with it. And we know him as, who is he?
You're not gonna
Wow. So, I know him as my husband, and he knows him as Daddy, but most of you know him as Dr. Mosher, so I'm going to turn it over to him. So thank you all for coming and supporting us again.
So we're far, far away. We're in a land far, far away, and there's this mama zebra giving birth to its baby. And it gives birth, and this baby is rolling around in the grass, enjoying the sun, just loving life. And the mom goes, "Baby, get up. You need to learn to walk and run right now." And like any other baby, it don't listen to its mom real well. Anyway, the mom intensifies her voice and says, "Baby, get up. You need to learn to run right now." I was born 5 minutes ago. Why do I need to get up right now? Because the lions are coming. And if you don't get up right now, they're going to eat you alive. Now I know what you're thinking, Doc, that is a really cute story. We ain't got no lions running around here. But we got the lions of heart disease. We got the lions of cancer. We got the lions of diabetes. We have lions of these illnesses that are robbing people of their lives, of their joy, and it leaves family members wondering why. So what I want to do, and real quick, and I'm sure no one has wondered this, but has anyone wondered, why is Doc buying my mill? What is the catch?
Yeah.
What's the sales pitch? Raise your right hand if you or a family member has been affected by cancer. Keep them up. Raise your left hand if you or a family member has been affected by heart disease. Keep them up. When is enough? You can let them down now. For the next 30 minutes, we're going to discover the most effective way, the most cost-effective way, and the most natural way to improve your health. So that you can have more energy, pain-free, and dramatically reduce the need for drugs or surgery. Who feels this is a good use of our time? Good. So if this information is resonating with you, we do have a special opportunity at the end that I'll share with you. But, you know, I really appreciate you guys coming, because for someone to take an evening out of their day to come listen to a crazy guy, listen to a health talk, at some level, health is a priority in your lives, which I think is awesome. Now, real quick, have you guys ever been to a sermon, seminar, really cool talk? And it was really good information, it was really inspirational, but you forgot everything you learned? I know I have. So my way of minimizing that is participation. Pretty much I'm just asking, are you guys willing to have fun with me? Because it's kind of like that person that talks about going to the gym versus going to the gym. Who's going to get better results? Yes. Oh, yes. So you just heard Ellen's story. You know, everybody hears it from me, how she had migraines and chiropractic swooped in. And you heard it from her, and I'm so glad you did. My piece to that story is I watched her suffer. I watched her cry herself to sleep every single night, like throbbing migraine every night. And it was the most defeated, powerless I've ever felt, because I didn't know what to do. I just had to watch this love of my life suffer. And it was really empowering for me to find out that chiropractic can help. And I will admit, it's really, really, really empowering that I'm a chiropractor and I can help her. I'm just going to throw that out there. It's pretty nice. But that's the goal of tonight. I want to empower you with information that could help someone that you love. Is that fair? Awesome. So, here's my question. Do we live in a healthy or a sick country?
Sick.
Yeah. I pulled out some stats. 5 out of 6 die from cancer or heart disease. A third of Americans have diabetes. And this stat really bothered me. Kids, you know, the little whippersnappers, you know, I got one of those. A fourth of them are on medications. They're on drugs. Advil, Tylenol, all that stuff. So what is causing these health issues?
The boobies.
All right. We got food,
Environment.
environment, exercise. If I don't spell something right, Just remember, I am a chiropractor.
Not a school teacher, I must
I am going to zoom in on that board.
We're going to pretend it's right.
Shorthand. Locomotive shorthand.
There you go. Any others?
Stress.
Stress. Oh, yes. I'll take one more.
Overdrugging.
That lack of exercise.
Well, we got exercise, so lack.
Oh, okay. So
You said
short
overdrugging.
course.
The chemicals in our food and all of that.
Chemicals in the food. Over drugs
That's the number one.
and chemicals.
Dehydration.
And dehydration. There you go. So, all of these are right. Now, what I'm going to do to make it simple, I'm going to put in 3 buckets. The first bucket is people don't take responsibility for their health.
Amen.
So who is responsible for your health? Is it the doctor?
Me.
Is it your spouse? Is it McDonald's?
All of that.
Is it insurance? Us. It is us. We are responsible. Now the third reason, I'm going to cover that at the end. So just make sure you guys remind me. The second reason, people have the wrong information. They have the wrong directions. They have the wrong map. So, you can have the best intentions to go from Louisville to Indianapolis, but if someone says, keep going south, you'll get there. Are they telling the truth? No. Or you're lost in Chicago and someone hands you a St. Louis map. Is that going to work? So, most Americans, we have the wrong map. Now, how do I know that? Because when I ask somebody, hey, how do you know if you're healthy? Doc, look good, feel good. Nobody in here has that map, do they? Because, you got marathon runners that die of heart attacks. You got bodybuilders that will die of strokes. They look pretty good. They feel pretty good. Or you guys, somebody in here probably knows somebody that has a family member that has suffered with cancer. And for the most part, they look good. They feel good. Is that right?
Right.
So, how many of us would like to learn better definition to health? So, health is function. The more function you have, the healthier you are. So, 100% function, you're healthy, you're alive. Your body is healthy and healing. 0% function is you are dead, yes. And experts tell us you don't feel any symptoms until you lose approximately 40% of function. So when you lose function, you have symptoms, and symptoms eventually leads to diseases. So how do we handle symptoms, diseases?
Meds.
Well, yeah. You ignore it, that's number one, which, Ellen, put it off, these migraines. Or you go with the American way. A pill, a potion, a lotion. So, and then the third option is you find a cause so that your body functions at 100%. Because, you don't, is your migraines because you have a lack of aspirin in your system? Is your constipation a lack of, I forget the name, stool softener in your system? No. So what I want to do is I want to talk about function and how your body functions. Now I am going to use Frank. Yes, I do name my spine. I see a lot of kids, so this is Frank the Tank. So this is a spine model. You got your pelvis and you got your neck here, and this is part of the skull. So real quick, you have a brain. Most of us do. And this happens. And then the minor one is the posture. Now, I dive into this a lot more in my stress talks that I do for the community, so I'm keeping it brief here. But you got trauma, so that's T1. T2 is toxins. The air we breathe, the food we eat, toxins get in our system, they affect our hormones and then alters everything. And then thoughts. Did you guys ever think thoughts could affect your spine?
Yeah.
See, the way you think about yourself, the way you think about your environment, your job, your situation, those cortisol levels, if they rise, they deteriorate your spine. So, that's how we get misalignments.
About gravity.
Gravity's always pulling us down. Every day. So, and I don't know if you guys can see this chart very well from the back. But what I want to share with you is the nerves that go down your arms and legs, they also go to the organs. So for instance, the nerves in the neck, they go to your eyes, your nose, your ears, your throat. So blurry vision, ringing the ears, sinus issues, headaches. Mid-back, you got your heart, your lungs, your stomach, so acid reflux, breathing issues, heart skips a beat, blood pressure, things like that. And then low back, you have large and small intestine. So you could have ulcerative colitis, Crohn's disease, irritable bowel syndrome, constipation, diarrhea. It's just a really crappy situation down there. So, you know, my main question is, when is the best time to get your spine checked? And Stephanie has the perfect timing of when she came into the office, so I'm going to let her share her story, so we can give a big hand for her.
Little girl, I was 4 and a half, and I was in a car wreck. And in that car wreck, my spine separated my T1, T2 vertebrae and pinched my spine. And that left me paralyzed from the underarms down. So as I got older, I wasn't strong enough to sit straight. So my spine grew crooked. And the older I got, the worse it got. And then I started having pain. The pain just kept getting worse as I got older, and the back got worse. And my spine was in an S. So I went to every doctor you could possibly see. And they all said, you're not a candidate for surgery, you're not a candidate for injections. Same clinics that had their own chiropractors. Wasn't able to see them, they wouldn't want to touch me, scared they'd make something worse, everyone. So I was in so much pain that I lost hope. And I have a 12-year daughter I'm raising, and she plays sports, she plays travel softball. And to go to her tournaments and things and sit for hours, you couldn't watch because you're in so much pain. All you can think about is, when is this going to end? I got to go home. I got to lay down. I can't sit here no more. And, you know, you go to church or anything, you can't hear what the preacher's preaching about because you're just thinking, I got to get home. I'm hurting. I can't take this anymore. So you can't enjoy your life. You're hurting when you're home laying down, trying to get relief. It's just nothing's enjoyable at that point, and you don't see any way you're going to get any help. Well, I had gotten to the point where I could do less and less with my daughter because it just hurt. And it was making me depressed. On top of being in pain all the time. Well, the fair came around, and I wasn't going to go because I was hurting all that. I thought, no, how many more chances am I have to do? And so I decided to go. And me and my dad went back through the barns, and I was walking past Dr. Mosher, and he stopped me and he said, can I check your back out? I said, yeah, sure. There's another person who'll be able to do it for me. And so he checked my back out, and he said, come in the office, let me do an x-ray. And he said, I can't promise you anything. He said, I want to look at your x-rays and see if there's any way I can. And so I was like, well, what's it going to hurt? You know, I'm already in all this pain. Do it one more shot. So I went in there. He took the x-rays, and he said, you know, come in here and I'll adjust you. And he said, we can see, you know, maybe it'll help. So he adjusts me, and I had so much relief off that first adjustment that I went back to the fair that next day and seen him and thanked him, because I had thought that was my destiny. And you start losing hope, depressed, you know, you don't know what you're. Here's another twist of that story. I took my daughter in with me, and I didn't tell him that she was having problems with her stomach. She did not want to go to school because she was doubling over in pain all the time. We were going to the doctors all the time, seeing gastroenterologists, having tests run. They're putting on all these different types of medications. And she had given up. She thought, this is just not going to go away. I don't know what to do. She even told me she didn't want to live anymore because it hurt her so bad. It was just every day. So while we were in there and he's doing my x-rays, she starts having one of the pains double over. He said, can I check her out and see if there's something I can do to help? I said, sure. You know, because that's your child. You do anything for them, but just someone can help them. So she went in there, and he felt her. I think he took x-rays first, and then he took her in there, and he seen on the x-ray where she had a subluxation in her lower back. And so he adjusted her, and then he rolled over, and he did this thing between her fingers where he rubs right here. And it went away. And that's the first thing that she had had that actually relieved that pain. So we kept going back. Of course, he got my back straight. In like 6 months, it was almost perfectly straight. I had never had any hope of that ever happening. And, you know, I finally got my life back. I'm able to do what everybody else can do. And nobody knows what that's like until you come through it, because it's the most desperate black hole that you feel like you're stuck into. And so we kept going, and then a couple of times of her seeing it, she was doing so much better, and the pains went away. She hadn't had any since. I mean, it was like a miracle for both of us. If we hadn't went to that fair, and I hadn't walked through the farms and seen him and listened to what he said and gave him a chance, because at that point I was done with the farmers. I mean, they just weren't offering me anything. And if all that hadn't happened, who knows where the both of us would be right now. Because we were both in a pretty desperate place when I ran into him. And I thank God every day that I changed my mind and went to that fair and ran into him. Because to us it was a miracle. It really was. We were in a really bad place. I just want everybody to know that there is hope. Because once you get relief, like something so good happens in your life to change everything, you want everyone else to know, hey, you don't have to live in that place. Keep looking. You're going to find a way to get help, because it's out there. And most of the time, it's in the last place you think to look.
Thank you for sharing. You know, just like Stephanie, she had a choice to be at the fair, and I had a choice to be at the fair myself. And, you know, honestly, we all have that power of choice. You know, you can choose to do what you want for yourself. You can choose what you want to do for your family. And, you know, I pray that this doesn't happen to anyone here at all. But what if your symptoms, you know, in 6 months gets worse? Or the nerve impingement develops into some sort of disease in your system? Wouldn't you regret knowing that you could have done something?
See, Daddy?
You see? Or, you know, on the other hand, you invest in your health. You invested in your being. And you end up 6 months from now healthier than you ever thought you could be at whatever age you're at. See? You know, that's why I created a wellness breakthrough And it's an evaluation that we do in the office. And it's not like your traditional consultation where you go in the office and you sit down with me and you talk and we prescribe you medicine and you leave the office more frustrated than when you came into the office. We're actually going to sit down. We're going to chat. We're going to get a history. And I'm going to do my spinal exam, see exactly what your spine's doing, so you know what's going on. But you also, we're going to take x-rays. That way, when you come back with your spouse or someone, a family member, you guys know what is going on with your spine. You know what kind of condition your spine is in. Now, if we went over to the hospital, St. Vincent, and they did the same evaluation, the insurance didn't cover it, how much would that cost? Out of curiosity.
$800
$800. So since we're a family practice, we don't charge $800. Our fee for that is $175. Because you guys are here tonight, whoever is new, most of you guys are already patients, but $30. And that gets you that full evaluation. But I want to go back to the 3 reasons why America is not healthy. So, lack of responsibility, wrong map, look good, feel good. And then the 3rd reason, I want to cover that now. The law of diminishing intention tells us that the highest intentions will decrease over time. So many people have the right intentions to do something, but they procrastinate. Procrastination is the thief of health. Cancer, heart disease, does not discriminate. Doesn't care how busy you are, how nice of a person you are. And a lot of people ask me, Doc, what about my kids? What about my spouse? Getting them checked. So if you register tonight, that $30, that's your household to get them checked. And the reason why Elle and I decided to do such a ridiculous offer of getting an entire family check is because families that are healthy together stay together. And you know, I want to share another personal story. That is priceless.
Yeah. Brandon's deep.
So, Isaiah, when he was born, he was 9 pounds, 9 ounces. I know. Yes, okay. So he was 9 pounds, 9 ounces. He was a really big boy, and Ellen is not very big. I don't know where he got his size from. But anyway, I remember being at the hospital, and Ellen tried and tried and tried. I mean, hours at the hospital, trying to have the natural, regular birth. Didn't happen. So he goes into C-section. And I watched this doctor, you know, everybody's gowned up and all these nurses are running around. I remember it to this day. And they have Ellen pumped up with so much stuff and her hands are shaking. Now, I'll watch the doctor cut my wife, small slip, and he rips my son out of her. Twist and turn, just whatever he can do to get her out, get Isaiah out. And, you know, at the hospital they do their checks on babies and everything. And he turns out good. And then we're with the family. And Ellen's still recovering, and I'm looking at Isaiah, and, you know, I'm feeling his head, and I'm feeling this big nodule, you know, swelling on the left side of his neck. And when I turn his head to the right, it was okay. And gently just seeing if he can turn to the left, he would scream. I mean, he would scream. So I adjusted my son 20 minutes after being born. what I wondered. What if I wasn't a chiropractor? What would his life be like if that subluxation, that atlas, the top bone in the neck, misaligned through his toddler years, through his young childhood years, his teenage years, young adult? What would that have done? Guys, this isn't a sales pitch. Chiropractic isn't a job for me. It's not a career. For Ellen and I, this is our mission. I invited you here tonight because I want you guys a part of it. I want you a part of this family because Washington County is suffering. So I'm going to have another patient share her story, if that's okay. You ready?
Yes. Wow. My name's Amanda, and unfortunately, I'd say I know what would happen with his son if he wasn't a chiropractor. Age 10, 11, I started having issues. I was running at school trying to do track, and I fell flat out on the ground. I had problems breathing, my chest was hurting. I was taken to the emergency room. They just said, oh, she's lazy, she just doesn't have it in her, she needs to exercise more or whatever. That became the new norm. From then on, I would have issues with my chest hurting out of the blue. As I got older, they said it was this thing called costochondritis. Short word term for it is called tights, where you get like a tightening in your chest, you lose mobility in your arms. I have been on so many different medications from the age of 12 up until a year and a half ago that medicines have, these medications have destroyed my stomach lining, my esophagus. They've created so much, just a whole lot of damage. The older I got, met him, I was 21, and he came into my life at a time that I don't even know how I survived it. Just barely knew this man, and he was taking care of me. When I mean taking care of me, I mean feeding me. Physically feeding me, or helping me change my clothing, or took over paying my car payment because I couldn't work, and we hadn't even known each other, what, 2 months? They kept saying, we don't know what's wrong with you, it's all in your head. I can't move my arms, but it's all in my head. I can't feed myself, but it's all in my head. I have been hospitalized, I don't even know how many times, weeks at a time. I've had MRIs, we figured it up, it's like 11 MRIs. I've been tested for MS twice. As I was told I'd never had kids. Obviously, I proved everybody wrong. I'm the one that came in with 4 kids. 3 of them are biologically mine. When I had my oldest, I was 24. And I would have to call people to come help me because I couldn't pick up my kid, couldn't feed her. She would be laying in her crib crying, and there was nothing I could do for her. And many a day, many days, I prayed to not wake up. My health got so bad that about a year and a half ago, I was driving, and I lost all mobility in both arms, both legs. Luckily, my kids were in the car, and I say luckily because they were able to get the car and park and help me get off the side of the road. For being able to feel like you can be a parent I understand completely. It's the most awful feeling in the world. So, he did my adjustment. Instantly had relief in my neck, in my head. I went like 3 or 4 times a week there at the beginning. I couldn't move my arms, and he did an adjustment, and within like a half hour I had feeling back in my right arm. 3 adjustments later, well, one of the other issues is cognitive. I sounded like I had a stroke or like a drunk person, and I felt really illiterate when I would talk. So I would avoid people because, I didn't want people thinking I was cracked out or something. So my speech was improving as he was doing the adjustment, and I was talking to him. Been a very emotional roller coaster. Anxiety, depression, all of that was because of my neck. Losing feeling in my arms and my legs, and not being able to take care of myself or my kids was the most awful feeling in the world. Jump ahead about 6 months into the recovery. No pain. None. I am no longer on any kind of pain medication. I'm not on any kind of arthritis medicine. I'm not on high blood pressure medicine. I'm off of everything, with the exception of thyroid. I have my life back, a life I never had. I am playing with my kids. I am able to go to school things and I'm a big supporter of a marching band. I'm a booster parent. I never thought in a million years I'd ever be a booster parent and be able to be involved and help at all of the performances, and I was so excited. I couldn't wait to get back to tell him that I went on a walk, 4-mile walk, by myself, unsupervised. I mean, that was the greatest feeling. And being able to drive again, I used to drag race, so I was able to get back behind the wheel of my car and just loving life. My daughter, my youngest, has sleep issues. She started having issues in school. Anxiety, ADHD, possibly Asperger's. Brought her into him. Her neck is just as bad as mine, but going in the opposite direction. With adjustments, she's top of her class. And she sleeps throughout the night, and she doesn't have social anxiety anymore. We can actually go and do things as a family. So I guess you could say I'm a huge, huge, huge supporter of chiropractic care, whether it's with him or anybody at this point, because without him taking the chance, I know for a fact that I wouldn't be here, because I was at the point that I didn't want to be here anymore. Even though I have those 4 beautiful blessings. So I'm a firm believer that chiropractic care is where it's at.
I want to add a little bit to her story. Because cases like arm, leg paralysis, just completely shutting down like she described, we didn't really cover that a whole lot in school. Like, that's different. And her mom was coming into the office and she was getting adjusted, but she was tense. She was really emotional. And I was like, hey, what's going on? My daughter she's in bed, she can't move. Her legs are stuck. And I said, that's interesting. And in my heart, I'm a believer. And something told me, get this girl checked now. And so I told your mom, whenever she can come in, come on in. The next day, I have a cancellation. I'm like, oh man, I'm just going to sit around and Susie has to deal with me when I'm bored. And all of a sudden, I see her mom and Amanda going up my ramp. And then it's all from there. You know. So I want to tell you guys about a family tradition. It's not mine. It's just something that I came across, and it's a birthday tradition. So it's based on how many years you're turning. It's how many wishes you get. So if you're turning 8, you get 8 wishes. If you turn 80, you get 80 wishes. And there's this dad, turning 42, and they have the cake. The whole family's gathered around, and he pulled out this long list of birthday wishes of goals that year. And he says, I'm going to learn how to fly a plane. I'm going to take everyone to Disney World, on and on and on. And everyone's clapping and excited and cheering. And the following year, same cake, same family, same dad, turning 43 this year. And when it came time for him to tell his wishes, he pulls out this little sliver of paper and says, my health. Earlier that year, he was diagnosed with terminal cancer. When you have your health, you have many wishes. When you don't have your health, you only have one. And that's the goal of tonight. Is my goal, Elle and I's goal, is to help you achieve yours, so that you can achieve as many wishes, as dreams, as goals as you want to. So, thank you for listening to me. I'm going to bless the food, and then we will eat together. So, dear God, thank you for allowing us to gather today in fellowship, and I pray that the food blesses and nourishes our bodies. And I want to pray that, God, you have given us all strengths and talents, and I just pray that we all use our strengths, whatever it may be,